All right, so continuing with the respiratory system. So here we've got the general respiratory system. Again, there's the larynx, you know it, thyroid cartilage is right there. There's the cricoid cartilage, here's the trachea. Now, as the trachea comes down, it needs to split into the two lungs, left and right. So there is this kind of really specialized piece of cartilage called the carina. It kind of looks like a pair of tighty-whities, but it basically allows this to split. As it splits, we kind of come up with the primary bronchus. You can call them the main bronchus, but primary, secondary, and tertiary makes sense to me, 1, 2, 3. And you can see that it continues with the rings of cartilage here. As we split from that into the secondary bronchus, all of a sudden we're not looking at rings anymore. We're kind of looking at patches of cartilage. Okay, we're looking at plates of cartilage, not really the rings. As we split off of that secondary, you become the tertiary. And again, you can see that instead of having the rings of cartilage, you have plates of cartilage. You'll also notice that the two lungs, the right lung actually has 3 lobes, 1, 2, 3. The left only has 2. 1 and then 2. And you can also see that there's kind of a chunk taken out of it. And that's because the heart, if you'll remember, doesn't sit straight up and down. It kind of comes out at an angle. So there actually has to be a piece of that lung removed so that there's room for the heart to sit the way that it does in the chest. As well as that, down here, you can see this huge muscle. This is the diaphragm. This is how we breathe. This is the primary way that we breathe. Most of the volume in our chest that is made is because the diaphragm pulls down. Kind of think of it akin to somebody pulling the plunger of a syringe and air going into that space in the syringe. As the diaphragm pushes down and pushes our organs that are down here kind of out of the way, it helps to increase the size and inflate our lungs. So as we continue to branch from the bronchi, eventually we get to these bronchi here. This is the terminal bronchiole, okay, meaning that it's the last bronchiole that doesn't have anything additional on it, okay? You can see that there's smooth muscle wrapped around it. This smooth muscle that you're looking at is one of the issues that people with asthma have. When you have an asthma attack, that muscle tightens down and it basically makes a drinking straw into a coffee stirrer, so you can't move air very well. Rescue inhalers, a lot of them are actually muscle relaxants so that they can get that smooth muscle that's clamped down to relax so that the person can breathe. You can see that we've got deep lymphatic vessels. You've got the nerve, the vein, and the artery also coming down. Now, as we switch from terminal bronchiole, we eventually become respiratory bronchioles. See these here. These are called alveoli. Singular is alveolus. This is where gas exchange normally happens. So as we change to bronchioles that actually have these alveoli on them, they become the respiratory bronchioles because it's possible to actually exchange oxygen and carbon dioxide where these are. We continue down. Eventually, we become a tube with these alveoli on the sides, right? So this alveolar duct meaning tube, right? The alveolar duct is almost like a hallway with rooms coming off of it at the sides. So you've got this tube with alveoli on both sides, okay? So that's the alveolar duct because it's got the alveoli on it. When we get to the end here, you'll notice that I've got kind of these sacs that have alveoli coming off of them. So the best way that I can think to describe this is like a cul-de-sac in a housing development. You've got kind of this space in the middle and different houses coming off of it. So the alveolar sac is this sac in the middle with the alveoli coming off of it. And each individual bubble, if you will, is called an alveolus, like I said before. So you've got the alveolar sac, the alveolar duct, the respiratory bronchioles, the terminal bronchiole, excuse me. Here are the pulmonary capillaries. Pulmonary is just a very fancy way of saying lung. So these are the capillaries where that gas exchange is happening, okay? So looking at the model, there's that thyrohyoid muscle, the inferior constrictor of the pharynx, the cricothyroid muscle, the thyroid. That single larynx that I was showing you earlier is off of this model. So you've got the trachea. Here's the right lung. You've got the superior lobe, the middle lobe, and there's the inferior lobe. Again, I'm going to go get the model. Just one sec. Okay, lungs are in me. So this would be the right side. If you look, you can see that I've got the superior lobe. There's that, having a brain fart, horizontal fissure. There's the middle lobe. And then I've got this oblique fissure right here. There's that inferior lobe, okay, that lower lobe. Okay. In the middle, you have the heart. Remember, the heart kind of comes at an angle. So your left lung, you've got only two lobes, the superior with that oblique fissure, and then the inferior. And down here, there's that muscle, that diaphragm, that when it pulls down, it helps to inflate your lungs. So again, got the hyoid bone, the thyrohyoid membrane, the superior thyroid notch, the thyroid cartilage, the cricothyroid ligament, the cricoid cartilage, the cricotracheal ligament. Here's that oblique fissure and the left inferior lobe of the lung. Notice the yellow, meaning we've seen it before. Now, taking that out, there's the pulmonary trunk coming off the heart. Notice it says pulmonary, meaning it's dealing with the lungs. That's all I'm going to ask you to know as far as the vessels go. There's that left pulmonary artery. Taking the heart out of the way, here is our trachea. Where it splits, there's that piece of cartilage I told you looks like tighty-whities, the carina. Here are the primary bronchus. Still have those C-shaped pieces of cartilage. Here's the split to the secondary. Now I've got those cartilage plates. Here's the tertiary. Notice again, I've got cartilage plates. I don't have rings anymore. Here are the pulmonary veins carrying the freshly oxygenated blood from the lungs back to the heart. Here's the left pulmonary artery coming out to pick up oxygen. Back here, there's the thoracic aorta. Here is the esophagus. Remember I told you it's kind of a collapsed tube behind the trachea? It's right there. See these two pieces of white here? These are actually the pulmonary ligaments. They hold everything in place. Here's the diaphragm again. There's the abdominal aorta. Notice because it's past the diaphragm, it's no longer in the thorax, it's going to be in the abdomen. So looking at the muscles that are involved in breathing. So when you are breathing out, okay, your diaphragm is going to be relaxed, okay? Where are you? There you are. The internal intercostals. So your ribs are kind of like a bucket handle, and the internal intercostals basically drop the bucket handle and kind of collapse this, making it so that your lungs empty a little bit better. Okay, so yeah, so those are, Rewind. Yeah. Internal intercostals and the abdominal muscles. When you breathe out really, really hard, think about it. When you can feel your abdominal muscles go real hard, right? That's because as they basically push in, they're pushing your abdominal muscles up into that relaxed diaphragm, emptying your lungs harder than if you just went, and that's it. So those two muscles, your internal intercostals and your abdominal muscles, are going to be the muscles of expiration, of breathing out. The muscles of inspiration, breathing in. That does include your diaphragm. As it contracts and pushes down, again, think of a syringe with the plunger. It allows for more space so that the lungs inflate. The external intercostals. So instead of taking the bucket handle and pulling down like this, the external actually pick them up like this, expanding. Now, it's not very obvious, but if you put your hands here and you take a really deep breath, you'll notice that it kind of does this and it kind of comes up in the front, okay? So you've got the sternocleidomastoid and the scalenes that are also kind of picking this up. The pectoralis minor, which again, picking up the bucket handles, and even your sternum a little bit kind of comes up, almost like a pump. It kind of comes up. Again, not to the point that you're going to be like, oh my gosh, is really, no, but you can feel that slight shift when you put your hands up here. So again, you've got kind of that same bucket handle being picked up to make more space so that your lungs can expand. And your sternum kind of getting picked up too as the ribs get picked up so that you're making more space for those lungs to expand when you breathe in. Again, looking at the heart. You've got the pulmonary trunk, the pulmonary semilunar valve. There are the pulmonary veins. Again, pulmonary, 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 right? So lungs, lungs, lungs. You've got the other side, the right side coming in with those pulmonary veins. And then along the back, you've got the right and left pulmonary arteries and the right and left pulmonary veins. Looking at the histology. So the bronchioles. One of the things to keep in mind with the bronchioles is that they are one of the places where we have ciliated cells. So I kind of talked about this, I think in AP1. I don't think I've talked about it in AP2. If you've ever noticed that when you choke on something, for a while, you're kind of still going, and then you're fine for like 10, 15 minutes, and then you're, because you feel something in the back of your throat. One of the reasons that that happens is because the trachea and the bronchioles are ciliated. And the cilia kind of work like a crowd at a concert. And they can crowd surf pieces of material that have gone down the wrong way up so that you can and get rid of them. So when you look at a bronchiole on a slide, you will notice that it isn't a smooth edge to that set of cells. It almost looks lumpy and bumpy. And the reason is because they've got cilia on them. So looking at a bronchiole, you'll notice that you've got cilia here. You've got goblet cells that are making mucus. You've got the actual ciliated columnar epithelium here. You can see the hairs, like I said. And then you've got the lamina propria, which basically just means connective tissue, okay? So here's the tracheal wall. There's that respiratory epithelium. There's the basement membrane where this is actually basically double-sided sticky tape to hold this to this. There's the duct of the seromucus gland. Remember, duct just means tube, so this is a tube that makes mucus to come up to here. And then these are actually the seromucus glands that the duct didn't get cut. You can see the perichondrium down here. This is split. Somebody tore this, but you can still see that kind of crunched perichondrium around this that would be the hyaline cartilage, the tracheal hyaline cartilage. So basically what you're looking at is this being cut this direction. So you're seeing this tracheal cartilage, okay? So looking at a bronchial, wait a minute, what did I miss? Okay, I didn't. So this is as if I took the lungs and sliced through this way, okay? So you're looking at lifesaver pieces. So you're gonna be able to see the alveoli, all the little air sacs. You're gonna see blood vessels, and you can see the blood inside, and you're gonna be able to see bronchioles. Remember what I said about them being ciliated. This does not look smooth at all. It looks very lumpy and bumpy, okay? So you've got the bronchiole. You can always tell because of that kind of uneven surface. You've got the pulmonary blood vessel where there is blood, and you've got the alveolar sac. See how it kind of looks like a flower with the sacs coming off of it? And then you've got the single alveoli, okay? A little bit closer. Again, see the lumpy bumpy? That's going to be your bronchiole. See the blood cells? That's going to be your pulmonary blood vessel. The alveolar sac, again, you've got kind of that flower arrangement. And then you've got one alveolus. You can see another one right there, just real small and single. Now I'm going to zoom in on the bronchiole, the wall of it. See the hair? Those are the ciliated cells. So you've got the ciliated wall of the bronchiole. Okay? So you kind of can't miss the bronchiole. Sorry guys, I've been standing for, I'd say probably 7 hours. I need to sit down. Oh. Okay, so you've got that ciliated wall of the bronchiole. Now let's talk about the alveoli specifically, the little sacs. If we're talking about exchanging oxygen and carbon dioxide, I can't have a big, thick wall that I have to go through. If you're talking about doing, and all of a sudden I'm exchanging oxygen and carbon dioxide, I can't have big, thick cells. So when you look at an alveoli, the cells that actually make up that alveoli are simple squamous. There's one layer of cells, and they are flat to make it easier to get through, okay? We have two types of cells that make up the alveoli themselves, and they're called pneumocytes. So pneumonia deals with your lungs, pneumocyte, lung cell, okay? You've got these very, very flat cells, kind of in lavender, that are type 1 pneumocytes. This is the site where the gas exchange actually happens. But then you've got these guys. This is not going to be a squamous cell. In fact, it looks more cuboidal than squamous. This is actually called a type 2 pneumocyte. Has nothing to do with gas exchange. It actually has to do with making a chemical called surfactant, okay? So the inside of your lungs are moist with fluid, okay? The thing is, how do I explain this? Okay. So the inside of your lungs are moist with fluid. And one of the ways that we can kind of get our lungs to recoil back is by the surface tension created by that fluid, okay? Think of the surface tension of water. Everybody's probably seen, I'm going to scoot this closer to me. Everybody's probably seen some National Geographic where, they talk about a mosquito and the mosquito lands on the water and they're like, watch as the mosquito walks across the water and the surface tension holds its weight. Something along that line. Well, at a microscopic level, that surface tension that's being created by water would be too tight for our lungs to be able to expand. So you have to remember, all of this moving and everything else is happening at a microscopic level. This isn't happening where we can see it. So one of the things that we have to do to kind of help so that these microscopic bubbles can actually expand, we have to break up that surface tension slightly. Now, everybody's probably seen a Dawn commercial for Dawn dishwashing soap, and they'll say, Dawn, it takes grease out of your way, bloop, and you see the grease go whoosh, right? Honestly, it isn't taking grease anywhere. All it's doing is it's breaking the surface tension of the water that grease is floating on. So when it hits, it breaks the surface tension, and yes, the grease goes out of the way because you've broken the surface tension of the water. Surfactant is kind of like that. Now, admitted, we're not doing the large amounts that you would for the Dawn commercial. It's microscopic amounts, but it's enough to kind of loosen that surface tension so that when we go to breathe in, it actually allows the alveoli to expand and fill with oxygen, well, with air that has oxygen in it. So the type 2 pneumocyte makes the surfactant that allows us to do that by breaking up the surface tension. Okay, now, the last type of cell that you will see inside of the lung is this guy. It's a macrophage. Okay, so I mentioned this before. Any part of your body that has access to the outside environment has to have defensive cells there. So the macrophages are inside of your lungs so that if anything happened to come in with the air, hopefully they'll be able to fight it. They'll be able to prevent it from making you sick. Does it always work? No. How do I know that? People still get sick. Okay, so looking at slides of the lungs, you'll notice that I've got these thin pancake-looking cells, right? But every now and again, I see a big, thick cell that doesn't look like a pancake. Again, thin pancake cells. But every now and again, I come across a cell that's pretty darn chunky. As well as that, you'll notice that some of these cells are just kind of hanging out in the middle of everybody's business. These are the macrophages. So our pancake cells, where oxygen exchange is happening, are going to be the type 1 pneumocytes. This is going to be my place for exchange. These are going to be these purple pancakey looking cells. Then we've got the type 2 pneumocytes. Again, doesn't look like a pancake. It's a big cell. It looks more cuboidal than it does squamous. Doesn't look like a pancake, looks more like a cube. And then, like I said, those cells that are kind of in the middle of everybody's business are going to be the macrophages. They're the ones that are just kind of roaming around looking to see if they see anybody who needs to get taken care of. Okay? So that's the respiratory system. There may be pictures of models. There may be pictures from your book. There will be slides. Okay.